Hello guys, how you doing? Today we're going to talk about differences between placebos and real medicines. Of course, you would know what are those things, but we're going to discuss it so much with details. And is it actually good to take a placebo? And what are why would we ever use placebos or maybe real medicines in some situations? So first of all, we know real medicine has like kind of active ingredient in there that makes it like to actually work. Like you have a sleep issues, like personally myself or I sleep issues I have, I take clonazepam and troncopine, and that makes me like sleep better and maybe for 6 or 7 hours. So yeah, it actually has something in it. And even maybe you don't know, like a doctor or maybe somebody tells you, okay, just take this pill. You have no idea what is this pill, and you take this and it actually has some affections because of what? Because it's actually a real medicine. But imagine about a placebos. On the contrary, placebos, there's no active ingredient in those pills. Like you actually have to have some expectations and some beliefs in order to like make it actually happen. Like they tell you you have depression issues, and the doctor tells you that this is a fake pill, not a real pill. They give you this fake pill, like we call placebos, that tells you that make you to be more like happy and you don't have depression anymore. So because you have expectations and beliefs, it's going to help you like you have you are less depressed than ever. So yeah, because of the beliefs. And but it actually has nothing active ingredient in there. And they use placebos for like testing, like if they want to test whether this new medicine they created is it actually working or not. So they use placebos and the new medicine they created. So yeah, like imagine you have headache, you take gelafen or ibuprofen. What does this do? Actually, because ibuprofen is a real medicine, it actually has active ingredient in there. And when you take this pill, it's going to reduce some chemicals in your brain called prostaglandins that causes what? Inflammation and pain. So yeah, because of the pharmacological things happening in this pill, it's going to make you get better at head because of your headaches. But on the other hand, like you take a placebo for your headache, again maybe you have like relieving symptoms because of the placebo, because you have the belief and expectation, like oh my god, because I'm going to take this placebo. You don't know it's a placebo. The doctor tells you it's a real pill. You take this placebo and you're like, okay, it's going to help my headaches. So you take this and your headache's gone. Yeah, as easy as that. Or maybe you have like sleep issues. You want to fall asleep for about after 15 minutes, but they give you a placebo and they'll tell you, yeah, it's going to make you fall asleep better, even it's not a melatonin pill, it's just a fake pill, placebo. And you take this pill and you fall asleep after 15 minutes instead of 1 hour just goofing around on the bed. So yeah, but of course, if you want to have a sleep, better sleep quality, like me, I told you I take clonazepams and troncopin and even risperidone in order to have better sleep qualities. So maybe you're asking yourself, how? I mean, does it really work? For some of aspects we can actually say that yeah, placebos do work actually, like if you have chronic pain, and you can actually like altering stress hormone levels, changing in some brain activity, even like your blood pressure or heart rate. So yeah, these effects actually are real, and but it has own limitation too. Like it cannot really do so much. Like it cannot kill the bacteria in your body. It cannot eliminate a virus. It cannot, for example, fixing a broken bone or maybe shrinking a tumor. Like like you take a placebo and you believe that is going to kill the bacteria in body or stopping the bacteria growth or survival, something like that. But the belief isn't going to actually like have some effects, because the beliefs has nothing to do with it. You actually have to take like maybe a real medicine in order to kill the bacteria for a virus you have in your body. Like maybe if you have like got a cold, you take like penicillin for your body. You don't take fake pills or placebos in order to help you, you know? Another question that got into my mind was like, why would even some people use placebos? Why would even doctors? Actually, in the modern medicine, doctors don't usually like use these placebos for the patients. They use it like historically, yes, like maybe they didn't have like some treatments, maybe even they gave like saline injections, or maybe they gave some vitamin pills, or maybe placebos because they didn't have the treatment, and they told the patients that this is actually these things I prescribe you is going to work. But nowadays they don't usually do that, and we have so much treatments for diseases you have, not all of them but most of them, like yeah. But what are the things they usually nowadays use placebos? If they want to like, we have something called clinical trials. What does that mean? It means actually like if they want to test a new medicine, like medicine Y, okay, and they want to know if this medicine Y is for headaches, isn't actually working, so they recruit for about 200 people to like test a new medicine, and they divide it into two groups, group A and B. Group A takes the real medicine, like the medicine Y, and the group B takes the placebo. And after the 1 week, 1 week later, they're going to do some research, and they see that, and they see reports from like the patients that maybe 85 out of 100 people from the group one, group A, I mean, got treated, but group B, that was like placebos, 35 out of 100 got improved. So that is actually mean that the new medicine actually worked, or maybe for chemotherapies, like there's no proven like there's no real treatment for this type of cancer they have, and like they divide again into two groups, and these two groups have the same chemotherapy, but they again invented a new medicine called medicine G, okay, and both of them are like the group A has the standard chemotherapy plus medicine G, but the group B has like the standard chemotherapy again, but plus placebo. So after 1 year, maybe they they take some tests, and they see that, oh, so like maybe 70% or 60% out of like 100% got better of because of the medicine G. But for the group B, that was like, with placebos, um, maybe 20% of them got better. So now we know the new medicine G is like have some treatment beside the chemotherapy alone. So these are the reasons they use, these are the things they use actually to know whether this new medicine actually working, like placebo, like they do comparison with placebos and medicines to actually know this new medicine is actually working or not. We even have something called open label placebos. So, but the name, by the name, we know that, yeah, like we have even some patients, they go to doctors, and the doctors tell them this isn't like on the previous things I told you. They told the patients that this is a real pill, but actually was placebo, but they told them it's actually real pill, it's going to have some effects on your body. But these open label placebos actually doesn't work. So like they tell the patients that this isn't actually a real pill, it's actually a placebo. And even some patient is still experience some symptom relief, and they say that, oh my god, it worked. And again, scientists are still like looking for reasons why this actually sometimes work. And let's talk about pills. Like individual person, every person, is like different, they have different response to pills. Like imagine Alice and Bob. Okay, Alice take the real pill for antidepressant issues, and she couldn't get fixed. But Bob take the placebo and actually get better. So placebos are better? No. Actually, scientists or researchers don't check by in one individual person's response to the pills. So they actually check on the group of people, bunch of people, like 100 or 1,000 of people, and to check whether this new medicine got work or not. They just don't check by like this person didn't work, so this pill doesn't actually work. No, no, no. They check by group of thousands of people. There has been a research by BMJ Research. They wanted to do some research on placebos, and they wanted to know how does it actually working. You know, is it just a waiting? Is it just a placebo or placebo plus behavior of doctor? So they recruit about 262 people that had IBS syndrome that like causes a stomach pain and bowel pain. And actually, this type of diseases we have is actually connected to nervous system and mind body connection. So like it's related to placebos because placebos are related to psychological things. So they divided into three groups, like we had waiting groups and group two, and placebo group. That placebo group like just had some acupuncture, but the needle wasn't actually real. It didn't actually penetrate the skin. And the group three was like placebo plus a warm doctor. So the differences between group two and three was like group two had the doctor, two all of them had the doctors, but group two, like the doctor was kind of like, hello, how are you doing, like, but the group three was like plus placebos. They had like a really good and warm doctor, like listen carefully, had empathy, expressed confidence, and talk so good with the patients, and like maybe have a good conversation with them. So yeah, they wanted to check whether it's actually working or not. So weeks later, they do some research, and the group one, the waiting list, they just waited. They didn't like get any treatment, and 28% of them got better. Group two placebos, about 44% got better, and group three, about 62% of people got better. So now we know, oh, so a warm doctor, like a good relationship between patient and doctor, has actually have some good effects. So maybe you're asking yourself, so the kindness of doctor actually help like cure the cancer, cure the disease? No, it just had some symptom relief for something like nausea. We have like IBS, or like maybe headaches, migraine, because it connected to nervous system and mind body and like psychological. And so maybe something like placebos that you dictate yourself is actually going to work. And even having a support from the doctor or from somebody is going to actually have some benefits and good things on your body and actually your mind, and makes you to like help your disease to get better and have some symptom relief. So yeah, it didn't actually cure the underlying disease, it actually like help to symptom relief. When there was a research for close biology, and they did research on people who had knee osteoarthritis, and they gave them a placebo and told them it's going to have some good affections. And when they took the placebo, they used this functional magnetic resonance imaging. This is a device, and they checked the brain activity of these patients who had chronic pain on the knee. And after actually they had like pain relief on the knee, and they checked on the device of the brain activity, like some greater activity in the middle frontal gyrus region of the brain is actually about one third of the frontal lobe. So yeah, the placebos actually worked like change in some of the brain's activity. So yeah, it have affections on the brain. So yeah, that's how placebos and real medicines work. But actually, you have to take real medicines. What I told you, the reasons why would somebody or some groups of people, researchers, use placebo